So, so these papers here are your assessment templates, okay? So what you're going to be doing when you walk in the room with a patient is that you're going to review a questionnaire that you'll have sent them. Ideally, you will have, when your patient's appointment is made, your staff would send them out a questionnaire, and it'll have a lot of the information on here. You'll ask them, and you can. I have a template. If you want one, let me know and just take my email address, and I'll send that out for you. The questionnaire for the patient. It'll have all this information on it, this history stuff, so that all you have to do, even before you go in the room, is review that stuff, highlight what you want to clarify with the patient, and then when you get in there, you can spend a few minutes, asking them a few more questions about their pain, and establishing a rapport, and then you can go on to your exam, and that gives you the most time to do the really important stuff that you have to do in the room with the patient to clarify your history. Even though you have these questions about their pain description on the questionnaire, they're not always going to give you all the information you need for that, but all the rest of this medical history and stuff, that can all be on their questionnaire. So then you move on to the exam. So there'll be a general exam, and that's stuff that you do for everybody doing anesthesia, so you don't have to do that today. So you'll start at the bottom here with your focal exam. So you have your cervical exam, your lumbar exam. It just goes on into, an exam flow. So the flow that I like for myself is to do anything that they have to do standing up or walking, like their gait exam or their lumbar range of motion. I have them do that. Then I have them get on the bed and do the sitting down portion. And if all they have is neck pain, and maybe I've already seen them walk into the room or whatever, then I might just have them sit in the chair for their whole part of the exam. But usually I need them on the bed because I have to get around behind them and do the sitting down portion. And if it's a lumbar, then there'll be a lying down portion of the exam. And then then you're finished. Then you can have them get back up, either get dressed or sit back in the chair, and then you can tell them what you think about what's going on with them and what your plan is. In the beginning, it's kind of nice if you have them in a gown, and then you let them get dressed after you get finished with your exam, and then you can go to your room and look stuff up and make your plan and whatever you have to do. And then you come back and you've got your diagnosis and your treatment plan all ready to discuss with the patient. So you can do that while they're getting dressed. It's kind of a natural break in things. So I want you to do everything that's on here with the patients. I have 2 patients with neck problems and 1 patient with a lumbar problem. And so you don't have to do all the lower extremity stuff with the neck patients, because tomorrow when you do the assessment, you're going to have time with the more lumbar stuff. But if we have extra time, then you can go over whatever you want to go over. Okay?